Jack Klein,
And I'm Ron Burgundy.
and we are here for ESPN RX talking to you about 3 pharmacy interactions.
And I'm not talking about the CYPs.
Alright, in all seriousness, we're talking about 3 vaccinations, in particular the shingles, pneumovax, and influenza.
Let's roll that tape.
Good morning, sir.
Ain't no good morning. It's cold out there.
Yeah, it's pretty cold.
Alright, so I'm here to pick up my Lipitor. And make sure it's Lipitor, not that genetic brand bullshit. You know that thing don't work.
Looks like he was a little upset on that one, don't you think, Jack?
Definitely.
Looks like somebody could use a scotch. A nice scotch to start his day. That'll take that right off.
A little early for that, don't you think?
It's never too early for scotch. Remember that, kids. Scotch a day
Right.
keeps the grumpiness away.
Ain't gonna work.
Absolutely, sir. What's your last name?
Randy Marsh.
And your date of birth, Mr. Marsh?
What do you mean with my date of birth? Look in the computer. It's there.
All right, I see you here, Mr. Marsh, with your brand name Lipitor.
Alright.
Mr. Marsh, did you get your flu vaccine for the year yet?
Nah, I haven't made an appointment with my doctor yet.
I can give you the vaccine here. In New York, we're licensed to give vaccines.
Sure, you're not a doctor.
No, I'm a pharmacist, but I can give you a vaccine here. Why don't you take these forms, have a seat, fill them out, and we'll be out of here in about 5 minutes.
Alright,
All right?
better than 5 minutes.
Absolutely.
This is great. This is perfect. He's a perfect candidate for a seasonal flu vaccine.
Why is that, Jack?
Let me tell you why. It's because he's over the age of 65. And did you know that an estimated 90% of flu-related hospitalizations and 50 to 60% of flu-related deaths are in the patient population over the age of 65?
That's crazy. That's
Amazing.
startling.
That is absolutely ridiculous.
I cannot believe the words that came out of your mouth and were processed in my ear and
Believe it or not, it just happened.
whoa. Well, I heard that according to the CDC, anyone over the age of 6 months is eligible for a flu shot. But the people that are high risk are the elderly. They're sad, they're wrinkly, they get discounts on things, they get nice parking spaces. But people that cannot get it, correct me if I'm wrong, are the people that have had a past medical history of the Guillain-Barré syndrome.
You don't want that.
French people, I assume. Also, if they've had a severe allergic reaction to the flu shot in the past.
Makes sense.
But I did hear something that was strange. I heard that if you get the flu shot, you can actually get the flu itself.
That is absolutely hogwash, Ron. Absolutely hogwash. Let me tell you why. This vaccine does come in different forms. It comes in a quadrivalent, trivalent, intranasal formulation, and it also comes in a live form and a not live form. It's attenuated. Okay. So this vaccine that this gentleman would be getting is attenuated. So it is not live. And when it's not live, it would not cause a person or any individual to get sick. So again, what you heard was something you heard wrong.
All right, Mr. Marsh. So I have the form you filled out for me. I'm just going to ask you a few questions real quick before we get started. You feeling sick at all this week?
Nah.
All right. Do you have any allergies to eggs or latex?
Nah. I love eggs. Nah.
All right.
Wait, is this gonna mess my Lipitor?
There are a few drugs that we'll be worried about when giving you a vaccine, such as if you took long-term prednisone, but for Lipitor, there's not a problem there.
I know, no prednisone.
No. So because you're over the age of 65, I'm going to be giving you the high-dose vaccine today.
High dose, you trying to kill me?
No, Mr. Marsh. High dose is recommended in anybody over the age of 65.
Oh, okay. This is not gonna make me sick, is it?
Worst thing that's going to happen with this stuff is you're going to get some arm pain when we're going to be injecting you, or you might get some flu-like symptoms, last for a short period of time. Nothing crazy, nothing serious.
Alright, so I only need to take this once and I'm good, right?
No, it's something you got to get every year. So every flu season, you always want to get a flu shot.
Every year? Crazy.
Absolutely. But it'll prevent you from getting at least those strains of the flu, and better than being in bed for 2 weeks, right?
Alright, good, yeah, I don't want no flu.
Alright, so let's get started. Roll up your sleeves.
Tell me what to do. Stop.
Jesus Christ! Ron, did you hear that?
That sounded painful.
It definitely did. I mean, it does go straight into his muscle. It is an intramuscular shot.
But it is a small price to pay to prevent the flu.
I mean, there are different formulations. There is a subcutaneous available. There's also an intranasal. However, that's reserved specifically more so for the children.
The children are our future. Yes.
Indeed, that is what Michael Jackson said until his last breath.
Allegedly said. I think the pharmacist did a fantastic job. Flawless job of counseling. He said the flu-like symptoms. You get the mild grade fever, the weakness, and the fatigue.
Yep.
But I feel there's more to this story. I think there's something very shady about this guy. I think there's something else going on here.
All right, well, let's dig a little deeper.
All right, Mr. Marsh, how was that?
Yeah, it wasn't bad. I'm alright.
All right, well, hang out in the pharmacy for a few minutes. I just want to make sure you don't get any sort of serious reaction. We'll be back in a few, all right?
Okay. Wait. Oh, I got a prescription from my doctor.
Take a look.
Something called Zostavax. I couldn't find it over the counter. Where am I supposed to get these tablets?
So Zostavax is actually a vaccine that I can administer to you. Actually, today with what you just got, it's for shingles.
Shingles? I ain't no shingles. I'm married.
Oh, Ron, did you catch a load of that? He pulled out a Zostavax prescription last second.
What in the name of Poseidon's trident was that?
I have absolutely no words. I am at a loss.
I always knew there's something very shady about that guy. He hasn't been to the doctor for a year, yet he has a prescription for. You know what? Moving on. Not important. What is important is that he did come in. He did come in to get treated, get the vaccine. Shingles is a herpes zoster virus. It's not something you want to play around with. It presents as a painful red blotchy blister on your side, sometimes on the face. Not my idea of fun, maybe yours. But it can last for it can last from 1 to 2 weeks, and it's very important that he gets this treated right away because anyone that's had the shingles or the chicken pox should be administered the vaccine.
Oh, and I was also told that you should get it if you're over the age of 50. All right?
Which he is.
That he is.
Coincidentally. So let's see how this plays out. Let's see how the pharmacist handles the situation.
Hit the tape.
Okay, Mr. Marsh. So I know you mentioned earlier that you're not needing long-term steroids such as prednisone.
No steroids.
Right. What I do have to ask you though, if you have any allergies to the antibiotic neomycin or to gelatin?
Nah, no neomycin. Nah, and no gelatin. I'm not allergic. No, I'm good.
So we should be in the clear. Do you have any questions for me?
Yeah. So I gotta take this every year, just like the influenza.
No. For this vaccine, you're just going to be getting it one time, and you're covered for the rest of your life.
Oh, just once?
Absolutely.
Okay. Is it gonna hurt? What's the side effects? Am I gonna feel sick from this?
So it might hurt a little bit more because unlike the vaccine that I just gave you that is into the muscle, this one's going to be going into the skin. So it might be a little bit more painful.
Oh, dang.
It's all right. One time, that's it for the rest of your life.
I'm watching.
The other thing that I wanted to mention though, is what you said, it's not going to get you sick, but it does have a common side effect of having a headache and of course the pain in the arm where I'm going to be injecting you and a little bit of redness. But again, just one time, so don't worry about it.
Sure, I should be getting this.
That's why the doctor gave you a prescription.
I mean, I'm 65. You sure a 65-year-old person is supposed to be getting this?
Absolutely. Absolutely. Shingles can be a very painful disease. So give me a minute. I'll get everything ready for you. Do it in a sec, all right?
There's something about this Dr. Ray. Very captivating. Very captivating. He went over all the major points. You know, the allergies to begin with when it came to the neomycin and the gelatin, both of which are very important. In addition to that, he went over the most important side effect of this vaccination, which is, the headache.
Okay, right. Yes.
And in addition to that, it was very, very key for him to have asked that if this patient was on steroids. You know why?
Why is that?
Well, this vaccine is live and it's contraindicated in immunocompromised patients. So if you're on steroids, you're going to be compromised.
Oh wow, I did not know that. But it's very good that the shingles was treated when it was before it happened, because shingles can present into a lot of serious complications. It can transition into things such as pneumonia, blindness, post-herpetic neuralgia, even death. So it's very important for our viewers at home to see if they get their grandparents, involved in this whole process. Go see a doctor, get the prescription to be treated at the pharmacy.
Absolutely. It looks like the pharmacist had a tough day.
Very tough day. Very tough day.
All right, let's roll into the second clip. See how we do.
Oh my God, it's so cold outside. Oh my God.
Good morning.
Freezing, man, freezing.
Absolutely. Good morning. My name's Christian. Welcome to Gray's Pharmacy. What can I do you for?
Hi, I am here to speak to the pharmacist.
I'm the pharmacist here, sir. How can I help you?
I am here for the vaccination shot.
Which vaccine did you need?
I talked to my doctor 2 days ago, and he was telling me that I need the pneumococcal vaccination.
I'm sorry, which vaccine?
The pneumococcal. Don't you know how to speak English?
I'm in love with the pneumococcal. I got pneumococcal.
You must be pneumococcal. Yes, I can give you that vaccine here.
Yes.
Have you been into this pharmacy before?
Never in my life, no.
Do you have insurance?
Let me see. I don't know if I have insurance. I have the Chase card. I have Freedom. No. I have Sapphire card. No.
Did you see that? What is this tomfoolery? Is he a clown? This is not a bank. This is a place of learned doctors. It is a pharmacy. What is Cirque du Soleil in town today? I don't know. Does this guy not know how to read between the word bank and pharmacy? It's just outrageous.
Calm down.
Puppies and
Yeah.
puppies,
Yeah,
ice cream,
Relax.
puppies,
Relax.
puppies and ice cream.
No.
No.
I have a Metro card. You take Metro? No.
No.
How about the ID card?
No.
The New York State Ed card? No.
Helps, but no.
No. How about this? Does this work?
Yes.
This is fine?
the
Oh,
insurance.
good,
Super.
good, awesome.
So I'll hold on to these. You can grab your belongings there.
Thank you.
Let me give you a form to fill out, sir, and
Yes, absolutely.
I'll get the vaccine ready in the meantime, okay?
Okay, thank you.
Yes,
Okay.
sir.
You know what would be really important for Dr. Gray to mention right now?
What would be?
The fact that it comes in 2 different formulations. Prevnar 13 and Pneumovax 23. Both strains together, when used, will cover a majority of the strains of the pneumococcal.
It'd also be pertinent for him to mention that anyone over the age of 65 is a candidate to receive this vaccine.
That's true. And for people that are over the age of 19, but have certain conditions that would make them immunocompromised, would make them candidates for this vaccine.
Like what?
Like those that have lymphoma or leukemia.
Also, patients that are not immunocompromised but have certain comorbidities that are over the age of 19, such as diabetes, having cochlear implants, they have smoking, or they have a history of alcohol abuse. Those are people that should also be candidates for this vaccine as well.
Absolutely.
So let's see what the pharmacist goes with this one.
I'm so fancy. You already know. Hi.
Hey, Mr. Dillon. So, a few questions for you before we get started.
Okay.
Do you have any allergies to latex?
I am not allergic to latex, no.
Okay. And are you on any long-term steroids?
No, no steroids. This is 100% pure muscle protein. Yes.
Okay, good job there. I also wanted to ask you if you've gotten either dose of the pneumococcal vaccine before.
No, I don't think so.
Okay, so you've gotten neither the Prevnar 13 nor the Pneumovax 23.
No, this is the first time I hear of this vaccination. I don't think I got this vaccination before, no.
Okay, so I'm going to be administering to you today the Prevnar 13,
Okay.
and then in 6 to 12 months I'll have you come back and I'll give you the Pneumovax 23.
So you mean I have to come back in 6 to 12 months over here?
There's 2 parts to this vaccine for you to be completely immunized against all the strains. So come back in 6 to 12 months, we'll give you the second one, and you're done, you're in the clear.
Oh my, I don't think I will remember. I have new phone, Galaxy Note 6. You can call me or maybe send me the text message.
No, we don't offer that kind of service, Mr. Dilla, but you could mark it on your calendar.
Okay.
Remind
Okay,
yourself.
I will put it on the calendar on the refrigerator. Okay, okay.
Absolutely.
Okay.
Do you have any questions for me?
I was wondering, is there any side effects? Am I going to get sick or will I not feel well with this vaccination?
Well, you're not going to get sick from this vaccine, but it can cause some pain in the arm where I'm going to be injecting you.
Okay, okay, don't worry. I'm muscle, don't worry.
Okay, not a problem. Give me a few minutes, I'll get it ready for
Sure.
you. Okay, Mr. Villa, got the shot ready for you.
Okay.
Just going to give it to you real quick.
Okay. That was very good.
All right, Mr. Villa, no problem. Just hang out for a few minutes. I just want to make sure you don't have any reactions, and you're free to go, okay?
Okay, I have to go real quick. I have Escalade waiting for me outside. I have to go.
2 minutes, okay?
Okay, okay, thank you.
Have a good one. I'll see you in 6 months.
Yes, yes, I will see you, Mr. Gray.
Wow.
Well,
He's got some touch.
very personal touch.
Got those magic hands.
Magic.
Absolutely. Well, just to roll off of what Dr. Gray said, it's really important for you to mention that it does have a dosing regimen.
Yes.
For the patients that are over 65, if you get Prevnar 13, you have to wait 6 to 12 months before you get Pneumovax 23.
What if I'm going the opposite way?
Meaning you got the shot.
Pneumovax 23 first.
Oh, okay, all right. I mean, if you get Pneumovax 23 first, you have to wait a full calendar year before you get Prevnar 13.
Wow, a full that's outstanding. I did not know that. Thank you.
No problem. There are a little bit of more specifics when it comes to this dosing regimen.
Well, let me ask you a question hypothetically. Let's say I was 64 years old, okay, and I got these 2 vaccines before the age of 65. That means I'm good. I don't have to get them again, right? It's not even a year.
No. See, the thing is, with this vaccine, if you get it before the age of 65, you're gonna have to get it again after 65.
Even if I'm 64 in 364 days.
But that's a little thing I have to tell you about
Oh,
that.
God.
All right. So if you get it at 64, and you need to get it again because now you're over 65, you're gonna have to actually wait another 5 years.
So I'd be 69.
You would be 69 when you get it again.
Wow.
Both vaccinations.
Both vaccines. Both
Yep,
vaccines. I understand.
Yep.
Okay.
Well, I also heard that there's a 4th vaccine that New York pharmacists can administer to their patients over the age of 65. of
You
course.
heard correct. Well, actually, you did not hear correctly. There's actually a 4th vaccine, the meningitis vaccine, but that vaccine is not like the other 3 that we've seen today.
How so?
It's not age dependent. You don't have to be over the age of 65 to get it. You can get it at any time. But I mean, there's a list of requirements. I mean, some issues, some people that should be getting it are college students that live in a dorm room, military service members, as well as the scientists that are cooking it in the lab, that are handling the bacteria. So so that's something that the general population should be aware of. Yes,
Absolutely.
Well, thank you for watching this edition of ESPN RX,
This has been signing off.
and I'm Ron Burgundy. Stay classy, Santiago.